Hi, my name is Casey and I'm an occupational therapist student at Kaiser University. In today's video, I will be answering some questions debriefing this week's simulation. And the first one is, share what you learned while completing this week's simulation. So, I don't think that I learned so much. I think that I, again, refreshed my memory. So we read this amazing article on the importance of different components of the chart reviews and all of that, and I definitely refreshed my memory on what is more important, right? So I had to put them from most important to least important. And patient safety, super important. Family-centered care, another important aspect. Equipment, facilities, special considerations, they're all important, but I listed them later on because I believe that the first things are always patient safety and family-centered care. So I refreshed my memory. It makes you think a little bit. It makes you be conscious of these things that you kind of take for granted. You know them, but you don't really put them so much into practice because you're not really required to do so when you're treating patients. So I refreshed my memory on these topics. I also watched this video that seemed to be in another language. Portuguese, I think, I don't know. It was in another language, and I saw that the different techniques they use in another country on how to increase the lower body strength of a pediatric patient. So we had to write what exactly was going on, what she was working on, without any type of information coming from the healthcare provider in the video. That was very think outside of the box type of activity. I really enjoyed it. I love the pediatric population. This is my area of expertise, and I really enjoyed the video because it makes me think outside of the box. It makes me think, hey, I could use this for my next patient. So yeah, these were some things that I learned or refreshed my memory on. Number 2, why is it important to share with the parent, guardian, the purpose of the activities that were seen during the occupational therapy session? So why was it important to share with the caregiver the purpose of the activities that were seen? You always want to communicate with the caregiver what is being done. Always, because they are the ones who take care of the patient. They are the ones that are going to make decisions based on the patient's care. So if they see that things are being done, that progress is being made, why you're doing things, they're going to be at rest with thinking, hey, this is the best care that my child is going to be receiving. So they're going to make better decisions. They're going to trust in you more to provide the best tips, to provide the best information to them, so that the patient can continue receiving the best quality of care possible. Caregivers are in charge of the patient, and you need to be sensitive to that and know that if the caregiver is okay and at rest with what you're doing, the patient is going to be okay. Number 3, provide an example of what you would say to a caregiver as to what occupational therapy is. So many times caregivers, they know what speech is, they know what physical therapy is, they know what behavioral therapy is, but many times they are confused on what occupational therapy is. And my simple thing or statement that I give is, I help your child get back to doing the things that they love the most or need to do the most, increasing their quality of life and independence, right? Their function in all occupations. So what is the occupation of your child? Going to school, playing. These are the occupations of a child. So I get them back to doing those specific school-related tasks or play skills that they need to engage in the occupations that they are required to engage in or participate in the daily. So simple. I help your child get back to doing the things that they need to do, working on their deficits and improving their skills. Simple. Number 4, how would you answer the question? So occupational therapy is like physical therapy and speech therapy, right? If my child is doing PT, then she doesn't need to do OT, right? Well, many times I do get this statement, and all I say is physical therapy, speech therapy, behavior therapy, they all have their area of expertise. Occupational therapy can strengthen all the areas they're working in, but we have our own specific area as well. Occupational therapy not only works on gross motor skills, fine motor skills. We don't only work on cognitive skills. we don't only work on even behavior skills as well. We work on everything, you know. So increasing the participation in all these therapies will definitely help their child improve, right? They're going to improve in their everyday life activities and the skills they need to engage in their activities. So do not stop participation in OT because they're receiving physical therapy. Physical therapy works on physical deficits. Speech therapy works on speech deficits. We work on all things that require them to engage in their occupations. So we literally touch on every little thing they need in order to increase skills that will lead them to proper functioning and proper engagement in their occupations. Do not stop taking them to their occupational therapy sessions. They need these sessions in order to thrive in their occupations. And then I follow up with, do you have any questions? Do you need any tips? Do you need any help? Do you need more information? And then I will provide them with more information. And this is it for this week's video. Thank you for clicking on the video, and I hope I covered all the questions. And have a good day.